I'm Marc Brown, a local attorney here in Columbia. I'm the son of a career airman who was stationed at Charlotte Force Base, and a mother's now retired after 35 years serving as a first grade teacher here in Sumter, South Carolina. I graduated from the University of South Carolina, went on to graduate from Emory University School of Law. I am married to Dr. Kiera Brown, a local pharmacist here, and have a teenage son. Um, I'm committed to my community. I currently serve on the Communities and Schools of South Carolina's advisory committee and as a board member for South Carolina Children's Trust, well, Children's Trust of South Carolina. These volunteer opportunities allow me to help individuals, especially children, and the systems and environment to which we all live. Children's Trust, who I'm here today to speak on behalf of, is the only statewide organization focused on preventing child abuse and neglect. We lead and support a network that shares our belief that all children should thrive, live in a secure family, and be surrounded by supportive communities. We provide funding, resources, and training to help our local program partners build strong families and positive childhoods and lead the state's coordinated efforts for family resource centers. The Strengthening Families Program, Triple P Positive Parenting Program, South Carolina Adverse Childhood Experiences Initiative, Home Visiting, Child Abuse Prevention Month, and Kids Count. I'm giving the third testimony on behalf of Children's Trust during these hearings, and will focus on adverse childhood experiences. Board of Directors Chair Tiffany Santagati and CEO Sue Williams have previously offered testimony at this year's hearings on affordable housing and the Department of Social Services, respectively. Adverse child experiences, sometimes referred to as ACEs, are traumatic events that occur in a child's life before they turn 18 years old. This adversity, this toxic stress, can cause harm to a child's brain and its development, which can result in long term negative health and social outcomes. ACEs include emotional, physical, and sexual abuse, domestic violence, substance use, and mental illness of someone in that child's household. Being separated from parents, including incarceration, divorce, food insecurity, and homelessness. 62% of South Carolina adults have reported one ACE as a child. 16% of South Carolina adults have reported four or more ACEs. The more ACEs a child experiences, the higher the chance they will experience depressive disorders as an adult. 79% of adults that have depressive disorder report multiple ACEs growing up. While ACEs may be common, the good news is that they're preventable. We start to address by building an understanding of the importance of addressing the growing mental health crisis in our schools. The NEEKC Foundation's 2022 Kids Count Data Book Count Report found that 12% of children in South Carolina reported experiencing depression or anxiety in 2020, a 55% increase from 2016, according to Kids Count. South Carolina is one of 7 states that experienced such a dramatic increase. While these numbers are pre pandemic, school districts are beginning to see an even more alarming increase in students experiencing mental health issues. In September, the Charleston County School District reported that there was a 300% increase in students that needed intensive mental health support compared to the 2016-2017 school year. These are There are reasons to hope. There are reasons to hope, though. Research indicates that addressing youth mental health needs can reduce or even eliminate pandemic related stress. The Children's Trust identifies specific ways to help children and youth thrive and succeed despite adversity. Support programs and practices that help youth feel safe and protected at home and give them a sense of belonging in high school. Create environments and foster relationships where youth are able to share their feelings, foster community traditions that allow youth to participate regularly and meaningfully, build opportunities for people outside of their immediate family that care about them. As the committee discussed earlier this year, schools are the most logical and efficient choice for mental health services and support for our students. Removing the burden of transportation, logistics, and time constraints gives students the chance to regularly meet with mental health professionals and build healthy relationships that can provide buffers and supports to build resilience in our children. I encourage the committee to continue to I'm wrapping up here. To continue to explore how to resource schools and provide the services to ensure that students can access them. Growing up, I remember I never had. I didn't have ACEs. Even though my father passed away when I was 4 years old, my mother, as a single parent, raised my brother and I had a fantastic childhood. But I do remember a lot of my friends and classmates did not have that. I didn't until I was older. I didn't understand how bad they had it, or the difficulties they faced. But I would like to do anything that I could to make sure children today aren't having to deal with that. I'm gonna skip to the end. Please join the Children's Trust in supporting those who are supporting our children. Let's make sure our schools have what they need to help our children navigate these anxious days. I thank you for your time today, and I appreciate all that you do for the children of this state. And I hope that you all will continue to do great things and help Children's Trust. Thank you.
Thank you.
Does anybody have any questions?
Thank you for working with Children's Trust.
Thank you. Y'all have a great evening.